ADHD true or false questions answered. Hi, my name is Hannah Salazar. I am a licensed mental health counselor and I'm a tutor and mentor for those who are taking their licensure exams. So let's talk about my video from last week. And the answers? They're all false. Every single one of them are false. And I will try to summarize as quickly as possible. But a lot of them they're kind of loaded with the correct answer. Number 1, ADHD can happen in adulthood. It's false. ADHD in and of itself is a neurodevelopmental disorder. This means that it affects how our brains are developing as a child, as a baby. You know, there's even research that goes into it, say how genetic it is, that if a parent has it, you're more than 50% likely to have ADHD. And so if we look at it through that lens, we can notice that people who are diagnosed at a later age in life, maybe college or adulthood or something like that, it typically means you've always had ADHD. Number 2, ADHD needs neuropsych testing for a diagnosis. That's not true. We can give a diagnosis of ADHD off of collateral in a really, really good interview. And when I talk about collateral, it has to be before the age of 12. Because again, it's neurodevelopmental. We're looking for those links that it was present during those crucial younger childhood years. And you also have to meet certain criteria for ADHD. So there's a lot to kind of go over with that. I'm not going to do it in this video, but if you want me to do it, I will make a video just going over the criteria in and of itself. Number 3, you can grow out of ADHD. Research doesn't support this. In fact, up to 85% of people who are diagnosed as a child will continue to have ADHD symptoms in adulthood. It just doesn't happen. It's a lifelong disorder. Number 4, medication doesn't help ADHD. False. Medications are first line of defense with ADHD. This is because, without getting too nerdy about how it affects the brain, it really helps our brain to just focus and pay attention and fill in the gaps where we have them. So medication works wonders. It's great. However, research has also told us that the best combination here is therapy to learn to manage yourself and your behaviors with medication. We've seen a lot of great success 48 months out, like post-treatment. So really, 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 that therapy and the medication, that should be gold standard in my opinion. So how'd you do? Let me know what your guesses were, if you were close, if you got all of them right. That's awesome. But I will definitely go a little further into this whole thing in the caption.